Wonderful. Thank you very much. Okay.
And if you want to share when you're sharing your presentation, if you like, you could just share the PowerPoint, and that way we won't see notifications or anything like that.
Okay, how do I, did you just see a notification come through?
Yeah, I saw your Teams notification.
Okay, good to know. Let me see how to share a little differently.
Yep, if you stop sharing, yeah, there'll be a sharing option and there'll be just PowerPoint and you can select that.
I see, not my screen overall.
Yeah.
Okay.
Perfect.
Okay, awesome. Thanks for the tip. Nobody wants to be reading my text messages during your presentation. Okay, wonderful. Gail and Charles, do you want to just kind of kick things off on your own and just say like, welcome, thank you for joining us, or do you want me to just announce? I don't have any formal bios, but I can just thank you for being here and kind of pass it to you. Either way is fine with me.
Rebecca, is this is the first of these events, wellness workshops?
Yep.
And I think it probably should come from you to sort of kick off the series, so to speak.
Sounds great.
And then pass it to us. That's just my leaning, if this is something that's going to continue.
Absolutely. That sounds good, Charles. Do you feel okay with that, Gail?
Yeah, I think that's a great idea. I mean, nobody cares really about the bios so much.
Yeah.
Other than our names, but I think it's great that we're having these workshops since people have requested them. So yeah, I agree.
Absolutely. Well, great. Thank you both. Okay, so we'll just hang tight. It looks like everything's set up, but we'll get started in about 5 minutes.
When I was looking through things, Rebecca, just by the way it is that you order things, I was going to start and go up to the first section that talks about assessing burnout.
Okay.
And with the modifications you made, I think because you shortened everything, it comes a little bit sooner, but I was going to go up until there and then ask Gail to step in at that point because the rest is her.
Okay, that sounds good. And just for, and I think you both were super receptive anyway, but I think part of what I was trying to do is I think there's going to be some stock slides that we have at the end of each wellness workshop that go over the resources and whatnot. So that was part of kind of the rationale for shifting things a bit. So that sounds really good though. Good plan.
Who would you advise then should comment on that part? That was a little bit of a toss up before when Gail and I first did this with OB.
Okay, if I talk through the resources. What do you think, Gail? I mean, I'm happy to speak to them if you want, but I think, Gail, you've definitely covered that before, right?
So I think after my part, there's the well-being index, correct?
Correct. Yep.
Yeah. I mean, I don't know that I'm that great with that stuff. I think there are 3 slides before that I could just as well skip, or 1 slide. I think there are a few too many of my slides.
Okay.
So I think after the stress and burnout section, I think we should spend a little time on the well-being index. I'm happy to give that to either of you two. I'm not so great with these live presentations. And then I think the wellness center, that might be good for you to do, Rebecca.
Okay.
What do you think, Charles?
Yeah, I think the resources in that regard specifically, that might be best for Rebecca.
Okay.
Because you probably have a more accurate read on what we're presently doing. I know of them, but don't know some of the nuances about what's available right now and what's not.
Sure, that sounds good. So I will, Gail, you just kind of ping me as you get to the end of your slides when you want me to take over. And it sounds like you'd like me to cover the well-being index.
Yes.
And then Center for Clinical Wellness, Rush Wellness Assistance Program, and then the self-care piece as well. And then do one of you guys want to come back in to kind of round it out for the conclusion, the suggestions for well-being? I'm happy to talk on it, but that might be a nice way for one of you to conclude.
What's the conclusion there, Rebecca? Is there a...
The conclusion are the suggestions for well-being. So those are the 2 slides that you had in your original presentation, that the lack of clarity leads to stress, incorporating 5 to 10 minutes of wellness into existing spaces, that kind of thing. And again, I can keep just talking on it if you want, but I just wanted to see if either of you wanted to, again, round out the presentation and kind of wrap us up.
Yeah, I can speak to some of that, Rebecca, because I think when we originally went through this, I had an example of something we were doing on the site consult service. It sort of fits with that. So
Oh,
Yeah.
perfect.
I can reference that.
That would be great. Wonderful. This is something I always wonder. Can you see when I'm moving my mouse around?
Yes.
Mhm.
Okay. I'll try to be chill with it then.
How many students attended your student workshop the other day, Rebecca? I saw you did one.
Yeah, it was both were pretty low attendance, like more intimate groups. But it was really good to do, and we recorded it so that way other students could take advantage as well.
Well, they asked and you gave. Good for you.
Exactly. Yeah, I know it was hopefully helpful and hopefully a stress reliever in finals week.
Good. Very good.
Yeah, thanks. Pedro, I know we're about a minute until. Will you tell us when folks are joining or when we should kind of be more ready?
Yeah, folks already started joining. We're at 12 now, and we're at 50 participants.
Okay, great.
Also, I do have the chat enabled. If you look at your bottom right corner, there should be a button for chat. If you select that, you'll be able to see the chat with all participants and stuff.
Yeah.
Here we go. Great. Oh, and you did chat to us. Thanks so much. I didn't see that. Okay. I know we're right at noon, but how do you both feel about getting started?
Let's do it.
Okay, wonderful. So thank you everybody who has joined us thus far for our first of hopefully many wellness workshops under the Rush Center for Clinical Wellness. These workshops are designed to target different areas around well-being, resilience, stress, burnout. And today we are lucky enough to have Drs. Gail Bosch and Charles Hebert to join us and speak through the topic that we have for today, which is finding a new normal in the time of COVID. And so again, this session is being recorded currently, and we will be posting it on the Rush intranet, Rush Wellness page for other folks to check it out at a later date. But please do take a break, enjoy, and we will be trying to monitor the chat throughout, but we will stop the recording after the formal presentation and we will have a time for question and answers. So please join me in welcoming Dr. Bosch and Dr. Hebert.
Thanks, everyone. I'm going to go ahead and kick it off by going through our objectives. But as we go through this, be mindful of what it is Rebecca just mentioned, that the chat room's active, and we'll try to keep an eye on it and come back to that later because we don't expect that we're going to use the full hour. So here's where we hope to go with the time that we have, though. We want to talk a little bit about the understood time course of disasters and their impact on mental well-being. This is not our research-based talk about any stretch of the imagination, but it gives us a good foundation for what it is people experience when they go through some kind of disaster, be it natural or, in the present case, the pandemic. The second thing we want to do is try to identify some strategies that help us find meaning and value in the face of a disaster. And I'm using disaster here sort of globally, but of course, we're going to try to anchor it to many of the frustrations and anxieties that all of us have had around COVID-19, particularly as the holidays progress. We'll talk about the use of a well-being index, which is a nice kind of quick and dirty way for us to assess how we're doing mentally and emotionally. And then that fourth point is really important, and Dr. Bosch will speak to this, recognizing, recovering from, and preventing future burnout. So that's where we're headed. Go to the next slide, please, Rebecca. Mm-hmm. So we need kind of a working definition first of wellness, all right? And we don't want to think of wellness as a particular kind of point on the calendar per se, but more of a process rather than a goal. Or as is stated here, a philosophy. It's based on the simple belief that advances in quality patient care are directly tied to the well-being and vitality of providers, students, and staff. Put another way, when we are well, our patients stand the best chance of recovery and also being well themselves. So that relationship is more, like I said, of a philosophy rather than an endpoint. Go ahead, please. So we're going to start off, first of all, by just talking about what's happened. And part of what we want to endeavor to do today is just give you a little bit of a historical frame of reference, because so much has happened since we learned about COVID-19 as a virus that came to the United States last winter. And it's been a number of months. So on the next slide, I'll show you kind of a little bit of a blueprint for the footprint of the pandemic. And many of you have probably already seen this, be it on social media or just it's found its way to you through different modalities. This is a slide from a pulmonologist and critical care attending that was put forward as a way to kind of understand what it is that we're all experiencing in a healthcare environment ourselves on account of the pandemic. So on the y-axis, you can see the health footprint of the pandemic, as it's called, and on the x-axis is time. So there's a series of 4 waves here. So that first wave that we all saw in March and April that you see sort of lavender colored there is pretty immediate in terms of its peak and speaks to the immediate mortality and morbidity of COVID-19. This was our effort to flatten the curve, right, back in March and April, specifically because so many patients were coming in, our hospital system was being overwhelmed. And there certainly was, because the virus was so novel, immediate mortality and morbidity. You can see that first wave tail, and all of us have experienced this, I think, is the post-ICU recovery, simply meaning that long after people kind of clear their acute viral infection, there are still consequences, pulmonary, rehabilitation needs, things like that, that require care, but not precisely in the ICU setting. And so there was a tail actually around that too, that lingered for a while. That second wave that you see there in green is the impact of resource restriction on urgent non-COVID conditions, meaning things like heart attacks. For instance, that was reported out of California that the number of MIs during the course of March and April went steadily downward, not because they weren't occurring, but because people were afraid to come to the hospital, even though they had searing chest pain. And so moving things around and restricting resources on account of COVID led to some repercussions in terms of non-COVID conditions. There are other examples of that too, like early in the pandemic, the use of Plaquenil, hydroxychloroquine. And there were reports that rheumatologists couldn't actually prescribe it because it wasn't available in pharmacies because it was being used for a separate purpose. The third wave speaks to the impact of interrupted care on chronic conditions, which blends a little bit with what I just mentioned as regards heart attacks. But think people with cancer needs, people who had infusion needs that had to come into the infusion suites when they were shut down, things of that nature. And then the fourth wave is what we're really here to discuss. Psychic trauma, burnout, economic injury to all of us who are clinicians that were seeing and non-clinicians that were seeing COVID patients firsthand. The important thing that I think we need to talk about and why it is we're all gathered today is that each of those waves, the first, second, and third, has a peak and then sort of a tail, but not the fourth wave. The long-standing nature of the pandemic going on for months and months, the fact that it itself came in waves and we're in the middle of another one now, puts continuous strain on us. And so it's important that we talk about some strategies to kind of make certain that we can deal with that. Go to the next slide, please, Rebecca. So hopefully that gives you a little bit of a footprint, or I say a blueprint for the footprint of COVID-19. And it talks a little bit about how it is that disasters actually kind of cycle in terms of their impacts on us. But all of us, I think, initially came to this hoping that there would be a peak and a tail, like I mentioned, for all of those waves. And that just hasn't worked out to be the case. It became increasingly clear that we're not going to get back to normal. We're going to have to redefine our normal. And that's pretty challenging. And along the way, of course, came feelings of being sad, stressed, scared, isolated, etc. And the idea that we'd return to the way things were was not really immediately in sight. And so we messaged a good number of things as a wellness group, asking people to talk to a friend or family member that you can trust, remembering, of course, that it's okay in this present environment, particularly back in March and April, to feel overwhelmed. And many of us still feel more of that because this has been cumulative, and that's understandable, and accepting that is a good first pass effort. Getting facts, keeping things in perspective, drawing on your talents. It's easy to lose sight of what talents we do have when you're kind of in the thick of things, but using your existing skill set can be helpful. And remembering, of course, how you've conquered challenges before and bringing that to bear on this experience now. So it required a period of adjustment that was, like I said, very challenging, but possible. And we'll dovetail more into that in a little bit. Go ahead, please. So at the very beginning, this is probably what a lot of us are feeling, right? We're confused, we're unsure. Everything was new, everything was novel. Even the virus itself was always referred to as the novel coronavirus. And it left many of us feeling bewildered and disoriented. We just weren't sure how this was going to go. And I think many of us had some working assumptions, but where we were looking for clarity, we didn't always get it, particularly from governmental authorities or things like that, because again, everything was so novel. So we felt confused, we felt lost. Go to the next slide, Rebecca. Mm-hmm. And the initial messaging was not anything that brought us more clarity. You can see that I gave you what I hope are some comical examples here. This product contains peanuts, right? And a tag that says remove child before washing, right? They told us things that we already knew or that we already had working assumptions around. And we'll get back to this theme a little bit later, that the lack of clarity obviously bred a lot of anxiety and a sense of worry in all of us, myself included. But because so much was new and foreign to us with this virus, it just wasn't helpful to get this sort of messaging. We were looking for something more concrete, but it wasn't immediately available. Go ahead. So we wanted to ask everybody who's on the call, who's joining today, to just kind of pause and do a self-assessment and ask, how are you responding to stress? How are you doing it then? How are you doing it now? Because this is something I think that is dynamic and changes over time, and so it needs to actually be built into our repertoire of doing routinely, rather than just at one point in time. And the wellness toolkit that we'll get to in a little bit, the index rather, the well-being index, will help to actually codify this a little bit. But we want to ask people to reflect. How have you been eating? How have you been sleeping? How have you been tending to those creature comforts? It does not sound scientific, but it's absolutely essential. How well you sleep, how well you eat, what is your body telling you at a given moment? We messaged that it's really important to find one credible source for media and stick to it. It is possible to actually schedule your anxiety. And back in March and April, we were proponents of the idea that instead of being glued to your device, getting media reports on a minute-by-minute basis, maybe watch the nightly news once a night, and just in that 30 minutes, get what you need and then leave the rest at the door until morning, right? Talking to a counselor instead of making a turning towards overuse of alcohol and drugs. This has been reported in the literature too, that alcohol use, illicit substance use tends to rise when disasters occur as a means of coping with some of the stress and anxiety. So all of these are good ways to kind of reflect on how you respond to stress and tackle them head on. Go ahead, please. So none of those really, though, answer the precise question of how it is that you make sense of this experience or find meaning, which is something that we said we would comment on when we put the objectives up as we started talking. And so one of the things that I actually like referencing here is a bit of a tangent into psychiatry, but an important one, is a psychiatrist by the name of Viktor Frankl, who's written extensively about man's search for meaning and has a very well-known book and treatise on this. He adopts and actually was the innovator of a style of psychotherapy called logotherapy, which is existential based, meaning exactly what we're here trying to discuss, finding meaning in one's life. Frankl's essential point was that life has meaning under all circumstances, even the most miserable ones. So even a negative event in your life can actually provide value and provide meaning and direction, and help you codify who you are and what your place in the world is. That might be a hard thing to take hold of, but if you're a believer in the idea that things happen for a reason, then whether or not something is positive or negative as it comes to us in life is not something we should consider. Everything has meaning. And finding meaning in one's life is itself our main motivation for living in the first place, if you buy into Frankl's thinking. The important thing is that we're not passive agents in the way that all of this happens. So while things may happen to us, and I'll get to that in a minute, we actually have significant discretion and ability to exercise and sort of solicit this meaning. We can decide how it is we choose to experience something that occurs to us in life. So put another way, and this is the way I tend to keep Frankl in my head, life provides multiple tasks for us, right? Like getting through high school, getting through college, finding a professional career, perhaps getting married, starting a family. These are all perhaps ambitions or aspirations that we have for ourselves that are sort of self-assigned but life assigns us multiple asks. And the big ask right now before us is, how are we going to bounce back from a global pandemic that none of us wanted? But it's there, and we have to make heads or tails of it. So it's less about aspirations and ambitions, and instead actually trying to figure out, how do we hit back? How do we answer those questions that life gives us? And that's a place to find meaning in the middle of a disaster. Go ahead, please, Rebecca. If you like graphics rather than text, I'll give you one here. This is sort of analogous to a concept called ikigai, which comes from Japanese philosophy, humanistic psychology. All of us have a bunch of different roles that we take on in any given day. And you can see in this Venn diagram here that there are things that we're good at. There's things that we are very loving towards, what we love. There's things that the world needs if you're very service driven, which all of us are in our profession. There's things that the world needs that we want to be a part of. And then, yes, at the bottom, there are things that you can be paid for so that you can make a livelihood of whatever it is that you're passionate about. And you can see how these circles intersect with passion, mission, profession, vocation. But at the center of that Venn diagram is what in Japanese humanistic philosophy is referred to as ikigai. This is sort of what wakes you up in the morning. It is your sort of reason for being and what keeps you going each day. And I would propose, as a way to kind of find meaning in a disaster, that because of this pandemic, because of everything that's happened over the course of 2020, many of us have been afraid or scared for the reasons that I laid out as we first started talking. You're probably afraid because your ikigai is at risk, if you want to look at it that way and kind of adopt this mindset, right? There was a chaplain colleague of mine here at Rush some years ago who used to say, yeah, when you're feeling fear, when you're feeling anxious or scared, it's uncomfortable, sure enough. But fear is also an arrow, was the phrase that he used. It points you in the direction of something that you feel is important that's at risk. Because let's face it, I think we can all agree, nobody gets afraid to lose something that's not important to them or that doesn't have value. So if you can stop and recognize the reason you're getting scared is because you found something valuable that you think you're at risk for losing, well, then you know what your values are. And perhaps that can help to concretize a little bit what your ikigai is. So I've always liked this screen and that saying that fear is an arrow, that it points you towards your values and the things that are important to you, because it can be very grounding when there's so much ambiguity and anxiety around. Go ahead, Rebecca. All right, with that as sort of a preface of like I said, the history of how it is we've gotten to this point and that blueprint that I first put up there and a little bit about finding meaning, it's important to kind of do some of that self-assessment. So to go a little further with that, we're going to talk more formally about burnout, and Dr. Bosch will take the lead.
Stuff.
There you go.
Can you hear me?
Yeah.
Yeah. Okay, great. Okay. That was stressful. So much in the way that Charles was talking about the ikigai and the fear, that's sort of a productive way to think of things. What's the difference between stress and burnout, and why is it important for us to understand? So similarly, stress can be productive. Stress is what propels us forward. We need a little bit of daily stress in order to get out of bed in the morning and make a deadline, et cetera, et cetera. Stress is normal. Stress is finite. Stress ends when we go to bed at night and refresh and wake up again in the morning. But burnout is no end in sight. Our society celebrates perfectionism and overwork. And in this time of the pandemic, everything's getting a little crisscrossed. Burnout is exactly what it sounds like. It was a concept that was recognized in the 70s, and it's not normal. It is avoidable. And what we're finding is burnout can be self-imposed, but it also can be imposed by management or organization. And that's why it's important for us all to understand what it is so that we can prevent it. It's 100% preventable as long as we understand it, understand what the warning signs are, and understand what coping skills are so that we can manage this in a little more healthy way. Can you advance to this, Rebecca? So in order to understand burnout, we should be able to recognize the warning signs. And interestingly, the World Health Organization, or WHO, redefined burnout recently. They updated the definition, and they redefined workplace burnout as chronic stress that's not successfully managed, that results in emotional depletion, increased emotional distancing, and decreased professional productivity. And there you can see some of the signs to look for that we're all kind of familiar with. So again, burnout is preventable. Next slide, please. And in the same way that trauma affects brain neurochemistry, acute trauma, we can deal with burnout similarly. And psychological first aid was developed for victims and survivors of traumatic events, survivors of war, acute trauma. It was developed by the Veterans Administration and also by the Children's Trauma Network to really help deal with survivors of crisis in the moment. And what we can do is use what's been learned to sort of help ourselves understand how to deal with this fourth wave, that long red unending curve that Charles showed us, and learn how to think about things and talk to one another in this time of sort of long unending trauma. Next slide. And interestingly, they've done brain studies, and sort of this long-lasting trauma is no different neurochemically in the brain than acute trauma. So victims of, let's say, like the Boston Marathon bombing, what happens in their brain is sort of what might be happening in our brain with untreated burnout right now. So things like cortisol levels go down, and oxidative stress, and it's brain-based, what we're feeling, right? So you're running on empty, literally and figuratively. So psychological first aid, we can think of it in terms of like the 3 L's, look, listen, and link. And it's really kind of a fancy way of saying, calmly tune into one another and learn how to confidently listen and link one another to help. There's nothing too super fancy about it. There's a couple of do's and don'ts that we can go over. But just like we do the ABCs of airway, breathing, circulation, we can do the ABCs of first aid. And a way to think of it is like always be curious, right? So we're going to try to sort of tune into one another and listen. Next slide. So something to keep in mind is that the antidote for stress, especially when we're listening to one another, is to remain calm, right? So the person that you're speaking with will gain confidence from you remaining calm, right? So we want to just, if someone approaches us and asks for help or asks us to help in a situation with a colleague or a friend, we're going to stay calm. And Charles mentioned earlier, focus on some positives, some strengths. We don't need to hone in so much on what's going wrong, but what do we have here? What's going right? What might be needed? And we have to try to steer clear of trying to fix things for someone else, because that's generally not what the person's looking for. We always want to fix things, right? We don't necessarily have to fix a situation. We have to just sort of join and listen. We want to not just listen in the moment, but maybe check in with the person the next day and reassure the person that they're not alone. And if the person needs a link to more help, I mean, it's pretty cool now because we have the Center for Clinical Wellness, and all of you are on this noon hour spending your lunch with us to learn a little bit more about some of the services we have right here. So if you're feeling burned out, or if you have a colleague who's burned out, you now know how to link for more help if it's needed. Next slide. Can you advance, Rebecca?
So this is the psychological first aid.
Okay, thank you. Thank you for that.
Of course.
So the don'ts are a little tricky and they're hard, and I'm just as guilty as some of these things on the slide here, but it's hard not to interrupt. We just have to, talk less and listen more. And one of the interesting things here that we should steer clear of is don't try to actively fix in the moment. So like an example of that might be if someone is saying, I'm so stressed out, it's hard not to say things like, well, you like running, go for a run, right? That's not going to be helpful. Just listen, right? And try not to sort of suggest and fix. Listening, and I'm just saying it sort of over and over to remind myself and to remind you, listening makes all the difference, sort of listening with care and compassion. And it's also okay if you're finding yourself, instead of feeling more calm in the moment, but feeling a little more revved up, it's always okay to ask that person, so you're sounding pretty stressed, I'm concerned, are you thinking about hurting yourself or doing something impulsively? That's always okay. Sometimes people ask me, wouldn't that be suggestive? Like, wouldn't that be sort of telling this person to hurt themselves or commit suicide? That's far from true, right? So it's always okay to check in, to ask that person, do you think you need some help right now? Can I get you to some professional help? Can we make a call together? That's always okay. And you also can't make promises you can't keep. So you can't say, like, this is 100% secret, I'll keep this a secret. You don't want to do that. You want to say, look, I don't think this is something we should keep secret. Let's go, let's take this up to the next level. Let's walk to our manager, or let's make a call to wellness. You can always do that. Next slide. So we also know, and Charles talked a little bit about this, so I won't belabor it, and we're going to talk about it at the end, but it very much helps, as we know burnout is preventable. So setting boundaries, taking care of yourself, because just like burnout depletes, we know active ways to replete, right? So what we eat, we don't have to change our whole method of eating, especially in the midst of a global pandemic. We don't have to learn how to meditate if we don't know how to meditate, but simple things. Like we know that serving of blueberries is good for brain health, or breathing, walking, or even crying. All of those things really change our brain health, sort of calm our limbic system down, and help in the moment. And the last thing I'm going to talk about before I turn it back over to one of my colleagues is a self-calming technique called tactical breathing. And it's just a series of four breathing in, holding your breath for 4, and 4 breathing out, and we can all do it together. And this is actually what they advise in the on the battlefield. So this is used in the military when people aren't focusing. So you can breathe in slowly for 4. So breathe in for 1, 2, 3, 4, and then hold your breath for 4, and breathe out for 4. 1, 2, 3, 4. You've actually just sort of performed a brain reset, believe it or not. I think we're all capable of breathing, that much I know. So, you know, we can all do that several times a day. And I think I'll just ask you, Rebecca, to go through the next couple slides. I don't have to talk about them, and we'll go to the well-being index.
Okay. So I think that in recapping what Dr. Bosch just went over, but before I dive in, I also was remiss to let you know who I am talking to. I'm Rebecca Leahy. I'm a clinical social worker with the Department of Social Work and Community Health and the Office of the Chief Wellness Officer. So thanks for having me join you all, along with my esteemed colleagues. And so I think here on the screen, we'd like to just highlight some of the scenarios where psychological first aid might be a good go-to, and where some of those skills that Dr. Bosch just went over in terms of psychological first aid do's would be very helpful. So looking at times when someone might approach you and ask for assistance, someone approaches you on someone else's behalf, or even just noticing that somebody's not quite themselves, or they look or sound distressed or agitated. So to reiterate what both my colleagues said before, wanting to be able to connect with yourself and see how you're doing, but also kind of being mindful and being observant of your colleagues is a great way to be able to support one another. And so when we think about the concept of well-being, it is important to consider how we are coping with stress. And so this is a reiteration of what Dr. Hebert went over before, but we wanted to come back to this idea of considering how we are coping with stress as we start to think about a validated tool that was introduced to the Rush community just this past fall. So it's called the Wellbeing Index, and it is a 7 to 9 item measurement that allows us to get a well-being score as we measure meaning in work, work-life integration, likelihood of burnout, severe fatigue, and quality of life. And so this tool is important in the sense that it is able to allow us to track our progress over time, understand and get good information on where our well-being is at a given moment, and also to connect to resources to support our well-being. And so it is a assessment that lasts 60 seconds. So it's only a few questions, as I mentioned, 7 to 9 questions. You can get your wellness score through the web application or the app on your phone. And you can then, from there, we'll get recommendations for resources, which will include a lot of the resources that I'm about to go over here related to the Rush Wellness team. So we will share the QR code in just a moment, but one of the other pieces that we like to highlight is that this tool allows you to compare your well-being score to your peers over time. So once you do the assessment for the first time and you get your baseline, you will see in whatever cohort you fit how nationally you're doing compared to peers in the same cohort. And once Rush gets enough folks in your given cohort, 100 at least, to take the well-being index, so the more of you who take it, then we'll be able to also see how you're doing compared to your peers here at Rush as well. And it's not a competition, but it's great information to be able to understand if you're on par or if you're doing better or worse than some of your colleagues, as a way to figure out what support steps might be helpful. And then finally, as we wrap up the piece of highlighting the well-being index, we also want to highlight that this is a great way to assess well-being over time. And so I know that a validated measure is a tool that a lot of us use in different practices, but this is a way to check in with yourself regularly. And I think it goes in both directions, right? It's very possible that if we're not getting better or if our score worsens over time, that might be a signal to think about adapting our care plan or thinking about getting additional assistance. And in the other direction too, if I'm having a bad day in 6 months, but I can see that my score is getting better, it's not to invalidate how I feel that day, but I may be able to reflect back and see how far I've come or see what things are feeling a little bit better. So what I will share now is the QR code. I'm just going to leave this up for a moment. And what we'd like to do is encourage you to take out your cell phone or device, and through the camera app, you can download this app. The invitation code is RUSH, and it takes a titch longer than 60 seconds the first time you log in to be able to add your name and email. But we'd like for folks to try it out today if you're willing to see how quick and easy. Okay. And so now I want to transition into some of the resources that, as I mentioned, are linked in the Wellbeing Index, but that are available to Rush staff and students to augment their care. So first, I'd like to talk about the Center for Clinical Wellness, which was opened just this past July. As you can see from these photos here, it's a beautiful space that's meant to engage the 5 senses when you walk into the room. And so right now we are offering only virtual services as of mid-November, just due to safety, but typically, when folks can access the space for their appointments, it's meant to be a getaway and a way to immediately feel a sense of calm once you step into the space and kind of out of your regular day-to-day. We offer appointments from 7 a.m. to 7 p.m. on Monday through Friday. And as I mentioned, right now we're exclusively doing video visits via telehealth, but we do offer telehealth throughout the year as well. Services that are offered are including counseling, well-being, coaching, and mini wellness retreats. And as I've demoed in some other recent presentations, it's a really quick and easy process to schedule on our Inside Rush page, on our Rush Wellness page on Inside Rush, And so I want to encourage folks, again, if you're curious, please go to that page, check it out. There are FAQs on the bottom that are extremely helpful to kind of know what you're getting yourself into. And I think what I'd like to do most is just to demystify the process. I know getting started and making an initial appointment can sometimes be difficult, but again, this is pretty quick and painless, and it hopefully will be a step in the right direction to get some support. I'd also like to highlight the Rush Wellness Assistance Program, which is, I have the number here, and it's another service that's available to our Rush staff and students, and it's available 24/7. And so it's a great resource for somebody who needs more on-the-spot counseling support, whereas with the center, scheduling is required 24 hours in advance. So this is a great complement in terms of a service. The other great feature is that they have phone counseling, video counseling, and as of November, they added text message counseling. And so that's, again, especially given folks who are maybe stuck at home and working from home, where you don't have as much privacy as you're used to, or trying to balance a lot of family needs and other needs, text message might be a nice option to lean into. But of course, the phone and video are also available. In addition to some of the tutorials that they have on their website that they've had for quite some time. And again, this is all on the Rush Wellness page on Inside Rush. And finally, I'd like to talk about some of the resources that are also housed on the Inside Rush page. And I think that the goal here is to really have folks who are willing to those folks who are willing to join us today. So thank you for taking the time. We want you to familiarize yourself with these resources. So not only the Center for Clinical Wellness and the Rush Wellness Assistance Program, but also we have a wealth of self-care resources on the wellness page as well. And I think, as you can see in the screenshot on the right, there are link outs to several relevant resources that are a great place to get started. As I mentioned, sometimes when we want to get started with something, it can feel daunting, or if we're at the point of feeling a little burned out or overwhelmed, trying to go to the internet and sift through what are the valid resources can be a little bit difficult. So this is a great place to start. And what we've seen also is for folks who are trying to integrate wellness into team spaces or wellness with your colleagues, these links can be a great thing to kind of reflect on as a group and to integrate into your meetings, to hold each other accountable and to celebrate some of those wellness forward activities that might result from this. This is an example of one of the links. This is the self-care guide. And I think it's a great example of how we can reset, take care of your mind, take care of your body, and use this again as a tool to not only use as an individual, but ideally in some team spaces as well. And so for the conclusion, I'm going to pass it back to Dr. Hebert, and then after that, we're going to open it up for a question and answer.
Okay, thanks, Rebecca, for going through that. And just to wrap up here and kind of bring a little bit of a summary to the things we've discussed, everyone, we'll just include a couple of suggestions for well-being that you can kind of incorporate, hopefully on a daily basis, because we very much want to, like I said, make this dynamic and not wait until you absolutely need to seek help, and just try to preserve your well-being on a daily basis. We highlighted when we first started talking how that lack of clarity, particularly back in March and April, where I put up that sign that had multiple directions that say bewildered, confused, etc., how that lack of clarity can foster stress in its own right. So the communication, the messaging is really important, and transparency especially. Communicating regularly, clearly, can address any emerging concerns and hopefully head them off with, at the pass before they rear themselves in a way that kind of is going to promulgate stress. One way to do this, and also just to kind of make this part of your regular work repertoire, is to incorporate 5 to 10 minutes of wellness into your existing spaces. I think many of us struggle with the idea that I have to carve out time now for headspace or mindfulness or meditation or whatever it might be that's necessary to keep all of us well. And it actually can be easily incorporated in some respects to what it is that we're already doing, rather than carving out extra time. So it doesn't turn into one more thing to do, but just becomes part of what it is your existing workflow. The example I like citing is actually way back at the beginning of 2020, even before the pandemic really kind of hit our shores. And I give credit to the associate chief on our service, Kirk Harris, for this idea. We started in our biweekly faculty meetings as the psychiatric consult service doing a round of positives and negatives. And so for the first 10 or so minutes of every faculty meeting that we have in my section, we just do a round robin and ask everybody to come up with something positive that they want to share within the past 2 weeks since we last convened, and in truth, something negative, not one or the other, but both. And it's actually worked very well. It does not necessarily derail us too much. Everybody has a chance to share. Yes, there's only about 7 or 8 of us, so if your group is large size, you can't necessarily accommodate everybody, but if you're working in small circles, you can. And it breeds a sense of communion, I think, that all of us are really looking for right now. And on a day when I've been really drained, or perhaps had more negative experiences than positives in the course of my workday, it's nice to hear that one of my colleagues just had a baby or a new addition to the family. And it really helps us thrive as a group. And actually that rubs off on you individually as a person. So just one strategy, the positives and negatives, that actually I think really helps me get to know my colleagues and my other co-faculty on a little bit more of an intimate level, so that we're not just working together, but we're really actually kind of going through the pandemic together and supporting one another. Go ahead, Rebecca. Don't know if there's anything more after that. Yes. So a few more things. She's already laid out, I think, nicely, Rebecca, a lot of the existing resources that we have internally at Rush. Encourage you guys to familiarize yourself with those. It's there's a wealth of different things that people can probably take from this. And we're not expecting, obviously, that everybody's going to connect with everything that is available online, because the way that people might choose to take care of themselves and ensure their wellness might not involve yoga, for instance, which is one that's not right for me, I will tell you, but there's others that you can sample. So there's a bunch of different things that you can do to support yourself. We encourage you to just scope it out by going to the Inside Rush page. Or if there's something that you have an idea about that maybe you'd like us to consider, or just need more guidance on something that you see that's already in existence on the Inside Rush page, you just email us there, like you see, rushwellness@rush.edu, and we'd be glad to have a discussion about it with you and what your needs might be. We're always open to ideas. Okay. Rebecca, how are we on time? Pretty good?
Yeah, we're pretty good. So we have booked folks' time for the next 5 minutes, and I know that if there is time that both of you have, go a little bit over that as well for questions. So I'm going to stop screen sharing for the moment, and I would definitely open up for questions, and I will be monitoring the chat as well if folks want to plug them in there. But thank you. See, we have 153 folks who had joined, at least at this point in time. I don't know if it was higher than that. So thank you, everybody, for taking the time, but please do share questions, thoughts, reflections. I'm curious if anybody tried the Wellbeing Index or if they have any other unique ideas about how to integrate wellness.
For the Wellbeing Index, so the email is necessary to register, correct?
Correct.
But it's confidential, right? The email isn't used for anything, right?
100% confidential.
Okay. So the email is collected. I mean, I did it myself, but I don't like, it's, you're not being monitored or followed or anything like that.
No, not being monitored or followed, but allows you to be able to access your score